Okay, well, I'd like to begin by explaining some of the key facts associated with pancreatic cancer. Pancreatic cancer has the lowest survival rates among the 21 most common forms of cancer, with 5-year survivals of less than 3% and 10-year survival rates of less than 1%. And to put this into the context of other types of cancer, for example, breast cancer, the 10-year survival is approximately 78%. So there's a significant difference between the survival in breast cancer relative to pancreatic cancer. I think even more depressingly is that these survival statistics haven't changed over the past 40 years. So we're currently where we are in terms of pancreatic cancer survival rates where we were 40 years ago. And again, other types of cancer, such as breast cancer, have seen survival rates increase significantly over the same time period. I don't think it's coincidental that the investment into the research in pancreatic cancer is the lowest among the 21 most common forms of cancer. So again, it attracts less than 1% of the national cancer spend for research. So to try and improve survival rates in pancreatic cancers, there's really 3 main areas, and this is common to every type of cancer treatment. The first is that we need to raise awareness. We need to raise awareness among the public and also the medical profession to be able to recognise more easily the red flag symptoms of pancreatic cancer. The second is if we need improved diagnostics. We need to be able to determine when pancreatic cancer is present. And also the third is we need new improved treatments. So in the terms of awareness, what sort of symptoms should we be looking for? Well, again, these tend to be very vague and they can be confused with other non-life-threatening symptoms. Okay, so typically pain in the lower back and the stomach, jaundice, sometimes a painless jaundice, unexplained weight loss, and also a change in bowel habits, so the appearance of fatty stools. A recent diagnosis of diabetes, for example, particularly in people that we wouldn't expect to have diabetes, so those with low BMIs. So what we really need to do is to raise awareness, and if anybody experiences symptoms such as these, then certainly we would be expecting further investigation into these patients. So the current treatments for pancreatic cancer include surgery, radiotherapy, and chemotherapy. Now, unfortunately, surgery remains the only possibility of a cure in pancreatic cancer, and this involves the surgeon removing all the tumour from the pancreas. But unfortunately, less than 20% of patients that present with pancreatic cancer, with the symptoms of pancreatic cancer, are eligible for removal of the tumour using surgery. So one of the areas that we're working on is to try and develop a targeted treatment for pancreatic cancer to try and improve the ability to shrink the tumour in a targeted manner. Because the treatments that I mentioned, the chemotherapy and radiotherapy, are very, very toxic treatments. They're very sore on the patient because they attack healthy cells as well as the tumour cells. And this leads to the very harsh side effects that's associated with them. So our treatment is trying to target directly the pancreatic tumour so that we can reduce the size of the tumour but spare the healthy tissue and reduce the side effects that's associated with that. So one of the challenges involved in treating pancreatic cancer is that the tumours tend to contain very, very low levels of oxygen. And this makes them difficult to treat using conventional treatments such as radiotherapy and certain chemotherapies that depend on oxygen to be effective. So the technology that we've developed here at Ulster University involves the use of tiny microscopic bubbles known as microbubbles. So we fill the core of these bubbles with oxygen gas, and on the surface we attach drugs. And we're able to use ultrasound exposure to selectively burst the bubbles in the tumour so we can selectively deliver both oxygen gas and drugs directly to the tumour. And this helps limit exposure of the drugs elsewhere in the body. That will also help reduce the side effects associated with the treatment. And we have shown that combining our treatment, which is known as sonodynamic therapy, with existing chemotherapies is more effective than the chemotherapies alone. So we are hopeful moving forward that we can develop this technology to deliver a clinical trial early next year, where we're investigating this combined technology in human patients.